Have you ever walked into a room and forgotten why you went there or had difficulty finding just the right word when you're trying to talk with someone? Memory loss can be scary, but there's many different causes and some of them are really normal or everyday things and some of them are very concerning. So hang with me and let's try to figure out what's going on here. As a reminder, I am a doctor, but I'm not your doctor. This is just educational information. So memory loss is a complex phenomena and the part of the brain involved with memory is called the hippocampus. And the experience of memory loss can be about short term memory or long term memory. And everybody forgets things, but it is a clinical level of forgetfulness that goes beyond a certain threshold. So the first thing to remember is that it could just be age related memory loss, normal aging. And you want to be able to distinguish that with something more severe, such as dementia. It is actually totally normal in the trajectory of aging to have mild memory lapses. And this is typically not a sign of serious cognitive decline. So keep that in the back of your mind. What's the baseline for your age? However, as things go on, we get on a lot of medications as we get older, and somebody might start on a medication and not realize that the side effects of the medication could actually be what's causing the changes in their memory. For example, if you're on a sedative like a benzodiazepine, such as Ativan or Klonopin, or an antidepressant. These often have cognitive side effects. Antipsychotic medications can also have what are called anticholinergic side effects. In addition, antihistamines like Benadryl or Claritin can directly impact cognition and muscle relaxants as well. So don't forget to check your medication list. Start with the common things, the easily reversible things. Next, you want to consider something like major depressive disorder because depression includes all these other things like difficulty enjoying experiences, low mood, feelings of guilt, but it also includes poor concentration and effects on memory and cognition generally. And severe depression is something that can even mimic dementia. Previously, severe depression episodes were sometimes called pseudo dementia because it was hard to distinguish. And depression is very common, so keep that in mind. In addition, it's very common to have insomnia. The vast majority of people will experience insomnia in their life, and this can impact memory consolidation. And typically, the effects are short term memory problems, not long term memory problems. You're not going to have amnesia for what you did when you were 6 years old. But even a single 1 or 2 nights of insomnia can impact the brain's ability to process information and specifically concentration, memory, but also mood and mood regulation. That's why people consume more refined carbohydrates the next day after they have insomnia. In addition, if you're regularly consuming alcohol, this can have a direct effect on your memory, especially if it's beyond 1 to 2 drinks a day. If it goes to the point where it's at the level of abuse of alcohol or binge drinking, this can cause damage to brain cells and lead to memory impairment, particularly if it's chronic, because the brain of somebody who's chronically drinking alcohol can mimic dementia and mimic a brain scan of somebody who has dementia. But unfortunately, a lot of young people with alcoholism will show a lot of memory and cognitive changes. In addition, you want to think about vitamin deficiencies such as B12 deficiency or thiamine deficiency. These are common reversible conditions that can be easily fixed by going to your local pharmacy. And there's a syndrome called Wernicke-Korsakoff syndrome, which has characteristic changes in memory and amnesia. So you can get these checked with a simple blood test. All right. You also don't want to forget about your thyroid because when your thyroid is underactive, this can also cause something like a brain fog with memory and concentration issues. You can get this checked with a simple blood test to check your TSH level. In addition, there's head injuries and concussions. And what happens, as in this video here, is when somebody hits their head, the brain will have a change in its location using this oscillatory force and will often hit the back and the front of the head, causing contusions and damage to particularly the frontal lobe. And traumatic brain injuries can often cause short term or long term memory loss, but it's going to come along with a bunch of other symptoms as well headaches, depression. So you want to consider if there's been a recent head injury or concussion. Now, mild cognitive impairment is not the same thing as dementia. It's a stage between normal aging and dementia. And these memory problems can be noticeable, but they're not disabling in the way that dementia is. And the conversion from normal aging to MCI to dementia can take decades and decades. But early detection is the key because you can change the trajectory of how bad things get. And now on to Alzheimer's dementia, which is probably what you might have been thinking about when you clicked on this video. Shrinkage in crucial areas of the brain, in the cortex, the outer bark of the brain, and also shrinkage in the language and memory areas, the hippocampus, and the increase in size in the ventricles where the fluid is. So you can see Alzheimer's disease on a CT scan or an MRI. And unfortunately, at this time, Alzheimer's remains a progressive disease, although there are a number of disease modifying medications hopefully on the way. And the best way to prevent Alzheimer's disease currently is to do all the things that will be good for preventing heart disease. In addition, there's another kind of dementia called vascular dementia, which is not the same as Alzheimer's dementia. As you can see here, it's primarily concerned with the vasculature, and a lot of the things that cause damage to the blood vessels in your body also cause damage to the blood vessels in your brain. So, atherosclerosis, as you can see here, which is the thickening of the arteries, small little strokes called microinfarcts, microbleeds, a blockage of the carotid arteries in your neck that go up to the brain and often lead to little strokes. All those things over time can cause vascular dementia. And your brain as an organ needs blood flow, needs oxygen. So anything that causes reduced blood flow to the brain is going to cause damage to the cells in the brain. And we often see vascular dementia develop in a stepwise manner as certain episodes of damage happen, such as a stroke or a blood clot or a transient ischemic attack, a TIA, which is like a mini stroke. Now, looking a little bit more in depth here on the left, you see what something looks like after a stroke, where a whole section of the brain has been taken out by a blocked artery. And then you see a small infarct or a small vessel loss of brain tissue. And here you see multiple infarcts, multiple places where there's damage. These are called periventricular hyperintensities, which means around the ventricles, periventricular, and hyperintensities because it's lighter colored. These are white matter lesions, so oftentimes these vascular strokes result in white matter damage. So over time, this builds up and it results in cognitive impairment. In addition, a third kind of dementia is Lewy body dementia. Now, here we see visual hallucinations as a unique feature of the dementia with memory loss and motor symptoms. So remember, motor symptoms are movement and visual hallucinations are seeing things that other people don't see. And what's interesting is that Lewy body dementia has an overlap with Parkinson's disease. Technically, Parkinson's is the syndrome. Parkinson's disease is one of the things that shows Parkinsonism. Another thing that shows Parkinson's is Lewy body dementia. So Lewy body dementia and Parkinson's disease are not the same thing, but they both show Parkinson. What is Parkinsonism? It's this combination of clinical symptoms, including stiffness, difficulty walking, poor coordination, tremor. And the reason we see that is because there's an overlapping set of damage to certain parts in the brain, specifically in the midbrain. So in this case, it's not caused by the same thing that causes Parkinson's disease, but rather it's caused by Lewy bodies. And these are particular descriptions of cellular damage that are particular to this type of dementia. We also see mood changes and, along with the memory impairment, sleep disturbances, changes in alertness. There's a whole unique syndrome that's separate from Alzheimer's disease and separate from vascular dementia, but can explain, especially in elders, memory changes. You also want to consider other neurological conditions that have memory loss as part of them, such as the ones that I mentioned, Parkinson's disease. Now, it's not going to be as frank as Lewy body dementia, but both of them are going to have Parkinsonism, and only some of the patients with Parkinson's disease are going to have such frank memory loss. Also, multiple sclerosis, because why? You have this autoimmune damage to the white matter or the myelin in the neurons, and that can happen in any part of the nervous system. So, if it's around some of the areas that affect memory, you're going to see multiple sclerosis affecting memory, especially in the later stages. Huntington's disease, which is a progressive condition that's inherited and often seen in family lines, which includes a lot of cognitive changes as well as other psychiatric and neurological changes. Stroke, as I mentioned, you can have a stroke that affects parts of the brain related to memory, transient ischemic attack, brain tumors and lesions that are touching on some memory areas like the hippocampus. So you want to think more broadly beyond Alzheimer's disease to other neurological causes and have a good workup. Now, if you're in the hospital setting, you want to think about delirium. Delirium is a more acute set of changes, meaning it happens more suddenly than dementia. Dementia is a slow, progressive condition, whereas delirium, you have a person who at 3 p.m. is totally with it, and then by midnight, their awareness, attention, memory, and orientation are off. And oftentimes we see this in elders who are in the ICU or in the hospital, and it has a fluctuating course. So the next day they could be back to their baseline. And people who work in the hospital deal with this and are familiar with it. So if you're visiting one of your family members and all of a sudden they're showing signs of memory loss and confusion, keep this in the back of your mind. In addition, we know there's all these causes of delirium that you want to think about. Infections, most commonly urinary tract infections in the elderly, pneumonia, medication side effects, anticholinergic side effects, opioids, being on too many medications, electrolyte imbalances. That's why when you're in the hospital, the doctors are always checking your sodium, potassium, chloride, dehydration, malnutrition, withdrawal from alcohol and sedatives, and liver and kidney failure because toxins can build up in your blood and that can affect your brain. That can cause delirium or chronic memory changes as well. Organ failure, and often after surgery, somebody will crash cognitively. And this is often what's happening, especially in the elderly. So think of delirium, but also think of just not being in the hospital and having an infection and inflammation, such as encephalitis, inflammation of the brain, meningitis, viral or bacterial. Often you see this in college students or people sharing dorms. They'll get outbreaks. HIV and AIDS has associated neurocognitive disorders. So does something like hepatitis, changes in the brain as well. So don't forget about infections. Infections really affect your cognition. Seizures and epilepsy as well. If you have a number of seizures over time, that can cause damage to different parts of the brain relating to memory. There's one type of seizure called temporal lobe epilepsy, and the temporal lobe is also where the hippocampus is. That's a memory encoding region. And that's why when you have multiple seizures in that part of the brain, you're going to have more likelihood of memory loss. Also consider autoimmune conditions such as lupus, because when you have a flare up of an autoimmune reaction, that's going to be going throughout your whole body and that's going to affect your brain as well. And autoimmune reactions can be bad for memory. Consider also PTSD and acute stress disorder because memory dysfunction is often a reported symptom in these situations, but it's often more related to the acute hormonal or neurochemistry changes of an acute stress response and the sympathetic nervous system and cortisol and other things that are changing fast that can directly impact memory and the memory areas of the brain. So thanks very much. If you've enjoyed this, check out this other video here and join my free newsletter anytime. Take care.